So a question patients often have is whether they have bipolar disorder or not. It's a diagnosis that's often applied in the community, sometimes correctly, sometimes incorrectly. People who have bipolar disorder have episodes of depression usually, as well as episodes of mania. And mania is what really characterizes bipolar disorder and separates it out from other psychiatric illnesses. So symptoms of major depression are probably discussed in other questions, but basically they involve changes in mood, interest level, capacity for pleasure, sleep, appetite, energy, self-attitude, and concentration, and the feeling that life is worth living. So all these will be on the downside if you have a depressive episode. With mania, it's almost the reverse. People with a manic episode, which is again what defines bipolar disorder, will have an increased or elevated or expansive mood. Although sometimes the mood is excited in an unpleasant way, sometimes it's even irritable, but there's some sort of increase in the energy that a person has that it manifests in mood. It manifests as well in an increased desire to pursue exciting or pleasurable activities, which often can lead to people getting into trouble because they might not use the good judgment that they normally have. Not that everybody who has bad judgment has bipolar disorder. It's a common misconception, but that if a person has uncharacteristic periods of poor judgment along with other manic symptoms, then you might think about them having bipolar disorder. So the other manic symptoms include not only an increased energy or for activities, but also an increased rate of thinking or racing thoughts. People have a lot of ideas on their mind all at once, sometimes hard even to keep up with them all. They tend to speak more rapidly or in a pressured way. Sometimes it's hard to interrupt people because they have pressured speech. There's an expansion of self-attitude or grandiosity. People will feel more important or more attractive or more powerful or more confident in ways that again, are uncharacteristic for them and sometimes are outside the bounds of reality. There's one symptom that's probably most characteristic of mania, and it's hard to, you don't see it in much else, and that is a lack of a desire for sleep. So whereas in depression there's a lack of good quality sleep, people don't feel rested when they sleep. With mania, people often feel that they don't have to sleep. They can get by with just a few hours of sleep per night, night after night after night, and not feel the need to catch up the next day. So you can have symptoms like this. If you have these symptoms and they're really significant, they impede your functioning, and they go on for a week or more is the minimum we use to define a syndrome, then you have a manic episode. And if you have a manic episode, unless there's some other explanation for it, we say you have bipolar disorder. So those are basically the symptoms of bipolar disorder.